Hello, my dear patients. Dr. Gordon here. Have you ever wondered if you're truly cleaning your body the right way? Many of us shower daily, scrubbing the obvious spots, our hands, feet, underarms. But what if I told you that some of the most overlooked areas on your body could actually impact your longevity? Yes, improper hygiene in certain forgotten zones can lead to infections, chronic inflammation, and even long-term health issues. As we age, our skin becomes thinner, our immune system weakens, and small hygiene mistakes that seemed harmless in our youth can have serious consequences. That's why I'm here to guide you through 5 critical areas that older adults often neglect, but absolutely shouldn't. By washing these spots regularly, you'll improve circulation, prevent bacterial buildup, and support your overall well-being for years to come. 1. The underside of your breasts or skin folds. As we age, our skin loses elasticity, and for many, that means developing more pronounced folds and creases. One of the most commonly neglected areas is the underside of the breasts in women and any deep skin folds in both men and women, especially around the abdomen or sides. These areas create the perfect environment for bacteria and fungi to thrive due to warmth, moisture, and limited airflow. Older adults, especially those with larger breasts or excess skin due to weight changes, may be more prone to a condition called intertrigo, a red, itchy rash caused by friction and moisture buildup. Left unchecked, intertrigo can lead to painful infections, unpleasant odors, and even open sores that take a long time to heal. This is particularly concerning for those with diabetes or weakened immune systems, as even minor skin infections can become serious health risks. To prevent this, it's crucial to wash underneath the breasts and in deep skin folds thoroughly with mild soap and warm water. Be sure to dry these areas completely, as trapped moisture encourages fungal growth. After drying, applying a light dusting of cornstarch-based powder or an antifungal powder can help absorb excess moisture and prevent irritation. For those who sweat excessively, using a breathable fabric liner or soft cloth under the breast area can help keep the skin dry throughout the day. If you notice persistent redness, itching, or a foul smell despite good hygiene, consult your doctor. In some cases, prescription antifungal creams or medicated powders may be needed to keep infections under control. Maintaining cleanliness in these hidden areas isn't just about comfort, it's about preventing infections and ensuring long-term skin health. 2. The inner corners of your eyes and along the eyelid margins. When people think of washing their face, they usually focus on the forehead, cheeks, and chin. However, one of the most overlooked areas, especially in older adults, is the inner corners of the eyes and the eyelid margins. As we age, our tear production decreases, leading to dryness, irritation, and an increased risk of blepharitis, a chronic inflammation of the eyelids caused by bacteria, debris, and oil buildup. Blepharitis can cause redness, itching, crusting, and even blurry vision if left untreated. It's also a major contributor to dry eye syndrome, a condition that affects millions of older adults. Beyond discomfort, chronic eyelid inflammation can lead to styes, chalazions, and even damage to the tear glands, making proper eyelid hygiene essential for long-term eye health. So how do you properly clean this delicate area? First, avoid using regular soap or facial cleansers, as these can be too harsh and cause irritation. Instead, follow these steps. Use a warm compress, soak a clean washcloth in warm, not hot, water and gently place it over your closed eyes for about 1 to 2 minutes. This helps to loosen any crusts or debris that have built up overnight. Gently clean the eyelid margins. Use a cotton pad or clean fingertip dipped in warm water with a small amount of diluted baby shampoo or a specially formulated eyelid cleanser. Gently rub along the base of your eyelashes, both upper and lower lids, to remove oil buildup, bacteria, and dead skin cells. Rinse thoroughly, make sure to rinse your eyes with clean, lukewarm water to remove any residue. Dry gently, pat the area dry with a clean towel, avoiding any rough rubbing. For those who wear makeup or have conditions like rosacea, which is often linked to blepharitis, daily eyelid cleaning is even more important. If you experience persistent irritation, excessive tearing, or frequent styes, consult an ophthalmologist. They may recommend medicated eyelid wipes, artificial tears, or even antibiotics if an infection is present. Properly washing the inner corners of your eyes and your eyelid margins is a small habit that can make a huge difference in preventing eye infections and maintaining clear, comfortable vision as you age. 3. The creases behind your toes. Most people understand the importance of washing their feet, especially older adults who may struggle with circulation issues or diabetes. However, one of the most commonly ignored areas is the creases between the toes. These tiny spaces are warm, dark, and often damp, making them the perfect breeding ground for fungal infections, bacteria, and painful skin conditions. One of the most common problems that develop between the toes is athlete's foot, tinea pedis. Despite its name, this itchy, scaly, and sometimes blistering condition is not just for athletes. It affects people of all ages, but older adults are at a higher risk due to reduced skin elasticity, decreased immune response, and difficulty reaching their feet to clean them properly. Athlete's foot can cause severe discomfort, cracked skin, and even secondary bacterial infections if left untreated. Beyond fungal infections, bacteria and sweat trapped between the toes can lead to unpleasant odors and painful skin breakdown. In severe cases, excess moisture can cause maceration, where the skin becomes overly soft and begins to break down, leading to open sores. For individuals with diabetes, this can be especially dangerous, as foot wounds take longer to heal and can lead to serious complications. How to properly clean between your toes. Use warm, soapy water. During your shower or bath, take extra time to gently scrub between each toe with your fingers, a washcloth, or a soft brush. Avoid overly harsh scrubbing, as this can cause small abrasions that allow bacteria to enter. Dry thoroughly. After bathing, it's crucial to dry between the toes completely. A soft towel works well, but for those with limited mobility, using a hairdryer on a low, cool setting can be a great way to remove excess moisture without excessive bending. Apply antifungal powder if needed. If you're prone to sweating or have a history of fungal infections, consider applying a light dusting of an antifungal powder to help absorb moisture and prevent recurrence. Avoid using thick creams between the toes, as these can trap moisture and worsen fungal growth. Wear breathable footwear. Tight, non-breathable shoes and socks made from synthetic materials can contribute to excessive sweating. Opt for cotton or moisture-wicking socks, and choose well-ventilated shoes that allow air circulation. Signs of trouble. If you notice persistent redness, peeling, itching, or an unpleasant odor, it's important to treat the issue promptly. Over-the-counter antifungal creams can help mild cases, but if the condition doesn't improve within a couple of weeks, or if you have diabetes, seek medical advice. Infections can quickly escalate and lead to cellulitis, a serious bacterial infection that requires medical treatment. Taking the time to clean and care for the spaces between your toes might seem like a small habit, but it's one that can prevent infections, eliminate foot pain, and contribute to your overall health as you age. 4. The back of your neck and hairline. Many people focus on washing their face, but an area that is often neglected, especially as we age, is the back of the neck and along the hairline. This region collects sweat, oil, and dead skin cells, creating the perfect environment for bacteria and fungal overgrowth. Over time, improper cleansing of this area can lead to skin irritation, acne, folliculitis, inflamed hair follicles, and even chronic infections. As we get older, our skin changes. Oil production may decrease in some areas but remain excessive in others, leading to buildup and clogged pores. The back of the neck, especially for those with shorter hair or those who frequently wear hats or scarves, is prone to trapped sweat and bacteria. In hotter climates or during physical activity, this buildup can cause heat rashes, itching, and even fungal infections like tinea versicolor, which leads to discolored patches on the skin. Additionally, older adults who have reduced mobility may struggle to properly reach the back of their neck in the shower. If this area is not cleaned regularly, it can develop a layer of grime that contributes to unpleasant odors, skin infections, and even stiffness due to accumulated sweat and oil irritating the skin. How to properly wash the back of your neck and hairline. Use a gentle cleanser. Instead of relying solely on shampoo runoff to clean this area, use a washcloth or a soft exfoliating sponge with mild soap to scrub the back of the neck thoroughly. If you have sensitive skin, a fragrance-free, pH-balanced cleanser is best. Wash after sweating. If you have been outside in the heat, exercising, or wearing a hat for an extended period, make sure to wipe the back of your neck with a damp cloth or shower soon after. Sweat left to sit on the skin can cause breakouts and irritation. Exfoliate weekly, once or twice a week. Use a gentle exfoliating scrub or a washcloth to remove built-up dead skin cells. This helps prevent clogged pores and improve circulation in the area. Dry thoroughly. After washing, pat the area dry with a clean towel. Moisture trapped in the hairline can lead to fungal issues or even seborrheic dermatitis, a condition that causes flaky, itchy skin. Watch for these signs. Itchy bumps or pimples could indicate folliculitis or clogged pores from oil buildup. Flaky or discolored patches might be a fungal infection, such as tinea versicolor or seborrheic dermatitis. Persistent odor could suggest bacterial buildup that needs more thorough cleansing. Keeping the back of your neck and hairline clean may seem minor, but it plays a big role in preventing infections, breakouts, and irritation. It's a simple step that helps maintain fresh, healthy skin and overall hygiene as you age. 5. The lower back and tailbone area. One of the most overlooked areas when it comes to hygiene, especially for older adults, is the lower back and tailbone region. While many people focus on washing their upper body and legs, the lower back often gets neglected, leading to sweat buildup, skin irritation, and even pressure sores in individuals with limited mobility. As we age, certain factors make this area more vulnerable to bacterial and fungal infections. Many older adults spend extended periods sitting, whether in a chair, wheelchair, or bed, causing friction, trapped moisture, and decreased airflow to the lower back and tailbone. This combination can lead to heat rashes, breakouts, and even painful pressure ulcers, bed sores, in severe cases. Additionally, the sacral region, the area around the tailbone, is prone to excessive sweat accumulation, especially for those who wear tight clothing, sit for long hours, or have reduced mobility. If not properly cleaned and dried, bacteria and fungi can thrive, leading to conditions like intertrigo, a red, inflamed rash in skin folds, or seborrheic dermatitis, itchy, flaky skin. How to properly clean the lower back and tailbone area. Use a long-handled brush or sponge. Since reaching the lower back can be challenging for some, using a gentle exfoliating brush with a long handle can help ensure a thorough cleanse without strain. Wash with mild soap and warm water. Harsh soaps can strip the skin's natural barrier, leading to dryness and irritation. A gentle, pH-balanced cleanser works best for this sensitive area. Rinse thoroughly. Soap residue left behind can cause itching and irritation, so be sure to rinse the lower back completely. Dry the area properly. Moisture trapped in the tailbone region can lead to fungal infections or even painful sores. Use a soft towel to pat the area dry, or consider using a cool-setting hairdryer for those with limited mobility. Apply a protective barrier if needed. If you're prone to irritation or spend long periods sitting, applying a light layer of fragrance-free moisturizer, barrier cream, or antifungal powder can help protect the skin. Signs of trouble to watch for. Persistent itching or redness may indicate a developing fungal or bacterial infection. Pain or tenderness could be a sign of pressure sores, which require immediate attention to prevent worsening. Excessive moisture or rash suggests intertrigo or irritation from prolonged sitting. For those who are bedridden or use a wheelchair, regular repositioning and the use of breathable cushions can help reduce the risk of pressure sores and improve skin health in this area. Keeping the lower back and tailbone clean and dry is essential for preventing skin infections, discomfort, and long-term health complications. It's a small but crucial step in maintaining proper hygiene and overall well-being as you age. And there you have it, 5 often overlooked areas that need extra attention to keep your body clean and healthy as you age. Proper hygiene isn't just about feeling fresh, it's about preventing infections, reducing discomfort, and even adding years to your life. By making a habit of washing these neglected spots, you're taking an important step toward better health, improved skin care, and overall well-being. If you found this information helpful, don't forget to hit that like button and subscribe to the channel for more health tips and advice. Your support helps spread valuable knowledge to those who need it most. Thank you for watching, and as always, stay healthy, take care of yourself, and I'll see you in the next video.